Kyphosis is an excessive forward rounding of the spine. It can occur at any age, but is most common in older women. The three most common types of kyphosis are postural kyphosis, Sherman's kyphosis, and congenital kyphosis. In people with kyphosis, the spine curves outward more than it should. As a result, the upper back looks overly rounded. The curvature can make people look hunched or slouching. People sometimes call it hunchback or roundback. The cause of kyphosis depends on the type. Postural kyphosis is caused by poor posture, leaning back in chairs, and carrying heavy bags. Sherman's kyphosis happens when the vertebrae has an abnormal shape, and congenital kyphosis occurs by a problem that developed in the spine before birth. Other causes include age, spinal injury, and abnormal vertebrae, which is caused by fractures and broken and crushed vertebrae. Kyphosis appears more often in teenagers whose bones are growing rapidly, but it can develop at any time. It may also develop in older adults. As people age, the vertebrae lose flexibility, and the spine may begin to tilt forward. Kyphosis can develop at any age. In adolescence, it may be diagnosed as Sherman's disease, in which several vertebrae are wedged together. In adults, kyphosis can be caused by arthritis, chronic disorders, genetic disease, injury to the spine, infectious diseases, and osteoporosis. Postural kyphosis can be prevented by being aware of your posture and by taking care of your back. Patients should be encouraged to avoid slouching, sit correctly by sitting upright and ensuring that the back is supported. Avoid carrying heavy school bags that can pull on the back muscles and ligaments, and take regular exercise to help strengthen the back and keep it flexible. Activities such as swimming, running, walking, and yoga are ideal for helping to prevent back problems. For the pediatric population, early intervention reduces kyphosis significantly and has very little effect on occupational performance throughout further development. As for the geriatric population, hyperkyphosis affects 20 to 40% of the population. It is associated with adverse health consequences including impaired function, pain, impaired pulmonary function, and increased mortality. It is important to monitor kyphosis regularly and do physical therapy and occupational therapy to maintain good posture.
There are many occupations affected by kyphosis. Examples of those would be work, play, socialization, sleep, health management, ADLs, IADLs, and leisure. Kyphosis is a medical condition that can cause many functional and occupational deficits. ADLs, for example, such as dressing and bathing, ergonomics, functional mobility such as transfers from sit to stand, and general body mechanics such as reaching, lifting, twisting, and sitting. OTs are an essential part of the care team to help patients with kyphosis as they work on treating posture and maintain postural control in sitting and standing in preparation for occupations and occupational performance. Posture can be controlled through bracing, and it can be controlled through muscle strengthening and increasing range of motion needed to perform such occupations. Occupational therapists can use two frames of references when working with patients with kyphosis. The first one being the biomechanical frame of reference, and the second one being the rehabilitation frame of reference. The biomechanical frame of reference is a remedial approach focusing on rehabilitating physical impairments and function. It is a therapeutic intervention that aids in restoring postural control of trunk muscles and prevents further functional loss through exercises done through yoga and hippotherapy, for example. This is mainly used for pediatric patients with kyphosis because these patients are usually diagnosed very early with kyphosis, and through early intervention, kyphosis can be reduced to the point where it doesn't affect further development. The rehabilitation frame of reference is a holistic approach that focuses on making an individual as independent as possible from physical, cognitive, and psychosocial standpoints. An example will be focusing on functional mobility such as transfers needed to perform occupations. This is mainly used for the geriatric population because kyphosis affects many of their occupations and physical health such as pulmonary health. OTs use this model to help patients regain independence in meaningful activities.
The assessments for kyphosis include the Berg Balance Scale, the Rapid Office Strain Assessment, manual muscle testing, functional independence measure, and the numerical pain rating scale and Wong-Baker-Faces scale. For interview tools, we will be using the Canadian Occupational Performance Model, as well as the Occupational Self-Assessment, or COSA, for children. Many of these assessments are cost-effective and relatively simple to administer. The Berg Balance Scale is a low-cost and feasible assessment tool that requires little training to implement. The assessment allows the practitioner to assess the fall risk of the individual and determine the need for ambulatory devices. Individuals with kyphosis often have an offset center of balance, increasing the risk for falls and decreasing functional mobility. This loss of balance may affect many domains of occupations that include the need for functional mobility. ROSA will help determine postural abnormalities caused by the individual's working environment. Due to poor posture weakening back muscles, it may further develop a more severe unnatural curve or kyphosis in the spine. It is important to address their environmental factors that may further degrade their condition. This will also help the practitioner address if any changes need to be made in their direct environment. MMT will establish baseline data to continually compare and contrast the effect of strengthening postural muscles. Anterior muscles such as pectoralis major and minor, and posterior shoulder muscles such as trapezius, rhomboids, and the rotator cuff muscles are involved with maintaining proper posture. Thus, strengthening these muscles may help limit further development of kyphosis. The functional independence measure is designed to assess areas of dysfunction in activities that commonly occur in patients with any progressive, reversible, or stable musculoskeletal disorder. Due to kyphosis causing functional mobility impairments, it is important to assess their independence levels in all occupations that may be affected. This assessment will help grade the functional status of the patient based on the level of assistance they require. NRPS is a recording of pain that will assist to monitor nature, severity, and duration of the individual's pain. Monitoring pain over time will reveal progression and treatment efficacy. It will also reveal a general understanding of how pain is affecting their functioning, motivations, and overall health. The Wong-Baker is essentially the same as NRPS, but it is adapted for young children utilizing FACES. Due to COPM being client-centered, it will help aid the therapist in identifying the client's occupational performance in self-care, leisure, and productivity. This will provide the basis of setting intervention and outcome goals for the therapist, as it reveals the client's priorities and desired occupations that should be worked on in treatment sessions. The COSA, like the COPM, also aids in building rapport with the client as it is client-centered. Although this assessment is adapted to younger children or clients in addressing and identifying their participation in important and meaningful activities, it also provides a basis of setting intervention and outcome goals for the therapist.
The first intervention approach would be finding activities that support the development of performance skills and performance patterns to enhance occupational engagement. More specifically, in the case of kyphosis, we would select activities that promote core strengthening, muscle strengthening, increase in flexibility, and muscle tension relief. A person with weak core muscles may struggle with keeping an upright position and is more likely to be slouching. Second, poor muscle strength, especially in back muscles, can also make it difficult to maintain good posture and proper body mechanics during activities. Muscle tightness can also pull the spine out of alignment. For example, having tight chest and shoulder muscles can pull shoulders forward and cause a rounded back. Lastly, muscle tension, which may result in pain, can decrease activity tolerance and ability to sustain any activity. From an OT standpoint, the purpose of focusing on activities that increase core and muscle strength and increase range of motion and less muscle tension would be to aid posture in preparation for participation in any meaningful activity. Hippotherapy, yoga, Pilates, and rock climbing are examples of activities we would introduce to our patients with kyphosis. Yoga is often recommended when it comes to improving posture and can be highly beneficial for patients with kyphosis. There are several yoga poses that strengthen and stretch the back, which will help align the spine. This video includes a few of these yoga poses, and I will explain how a couple of these can be performed. The first exercise is laying down on your back with arms straight above your head and palms facing up. Legs and feet should be straight as well. Slide arms down towards your body until your elbow is about a 90-degree angle. Hold for a second and then reach arms back up above head to starting position. Repeat 10 times. For the next exercise, you need to get on your hands and knees. Make sure your wrist is directly under your shoulder and your knees are directly under your hips. Keep a neutral spine and bring one arm straight up by your ear. Keep this position for a few seconds, then bring the arm back down and repeat with the opposite arm. Perform 5 times with each arm. Both of these yoga exercises are great for stretching and strengthening muscles in the mid-back, and you should feel it in your scapular region, or more specifically between your shoulder blades. The next intervention approach would be providing education training, which could include ergonomic education to adapt workspace for proper body mechanics, education on sleeping position, pain management, and precautions. Many patients with kyphosis may be unaware of how poor body mechanics can worsen their condition. They may have a desk job that requires them to sit for most of the day. If the desk is too tall or too short, or if the chair offers poor back support, we may need to adapt or modify their workspace. There are several adaptive pieces of equipment that can be used by patients with kyphosis to help improve their posture. Braces and tilting chairs are options to consider that can help align the spine correctly. Lastly, we could focus on mechanical modalities. The overall goal with this intervention approach would be to increase range of motion, decrease pain, and as a result, improve overall occupational performance. Due to spinal misalignment, many patients with kyphosis experience muscle tightness and pain. As OTs, we can relieve muscle tension and as a result prepare muscle for movement by performing and teaching stretching techniques for the upper back and providing soft tissue massage. This intervention approach may be ideal at the beginning of the session to relieve pain and tension and increase function before participating in any activity. Here are some pictures of adaptive devices and techniques for kyphosis. In the first picture, we can see a tilt chair, which allows the patient to maintain a neutral spine and proper posture while working on the computer. The second picture shows a back brace that can prevent kyphosis from worsening and help remind the patient to keep and maintaining their posture. The brace can be used throughout the day while engaging in everyday activities and may even be used during sleep. The last picture demonstrates a yoga pose and the use of a soft material yoga block to help stretch and extend the upper portion of the spine.
Two suggestions for community resources are Mosaic Yoga Therapy, which is a physical therapy clinic that uses yoga-based interventions to treat all types of acute and chronic pain or injury, and Water PT Aquatic Therapy. They use the physical properties of water to assist in patients' healing and exercise performance.